your permission slip to raise your standards and live an even more amazing life. Now, if you're feeling like that's way out of the ball game and you're really suffering with like pain in your body, guilt, shame, anxiety, depression, like these emotions run a lot of people's lives, and that's not by accident. Our culture is set up to keep us in those emotions because it's easier to control people when they're in those emotions. But if you're on an awakening journey and you have recognized that those are there, you have taken the most crucial step to get out of that, which is to become aware that it's actually happening. I turned to so many things to find a solution to that, and a lot of it didn't work. A lot of it really didn't work for me, but some of it did. And those things that did work are the things I'm going to share with you today. Okay, great. Welcome. Hello, everybody. I'm so excited to be here. Today, I am going to be speaking with Robyn Cogger, who is a naturopath for neurodevelopment health and specializes in autism, ADHD, epilepsy, OCD, and PANDAS, some of which you're going to have to tell me what they are because I haven't heard of all of them yet. So you are helping people who have children who have multiple diagnoses, multiple, sort of like mental health problems or differences, and helping their children return to a healthful state or a more healthful state than where they are.
Or on a good. Sure. Yes. It's very much a pediatric assessment with family, the parents, and the child. So usually, most of my cases are autistic children, but autistic children generally have comorbidities as well. Up to 70%, I think it's documented that autistic children, at least one, will have issue, whether it's anxiety, obsessive compulsive behaviour, OCD, Tourette syndrome, and then other conditions like intellectual disability and epilepsy. Yeah.
So for people who might be watching this who don't necessarily know much about how the gut-brain connection impacts autism and ADHD and epilepsy and OCD and PANDAS, you're still going to have to explain that last one because I'm not familiar with that one.
Oh, PANS and PANDAS. I'll explain that one. So PANS and PANDAS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS is a subset of, but essentially what it is, probably about 10, 15 years ago, it started to become a very visible and started to be established evidence, a condition where children would develop neurological symptoms and psychiatric symptoms after an infection of strep throat or scarlet fever. And there was a set of children who, after having strep or scarlet fever, would develop severe psychiatric symptoms. And they discovered that this was to do with streptococcus infection, mostly in the gut, but it can occur elsewhere. That would actually cause the brain to become inflamed, particularly the area known as the ganglia, kind of at the back. And it creates symptoms of OCD, so obsessive compulsive thinking, compulsive behavior, and also tics as well. So when we find that if you resolve the gut infection, that symptoms resolve. Yeah. So so it's pretty exciting. It only recently got recognised as an illness by the National Institute of Mental Health in 2017. It's still yet to appear in the DSM, which is the diagnostic diagnosing mental disorders. And it's just made it into the International Classification of Diseases, the OCD, which the WHO kind of put together every few years to identify and define diseases. And it got put in a little category, autoimmune diseases, other specified, PANS and PANDAS. So it made it in there for the first time in the new one. So
and
technology. technical aspect, yeah.
Yeah, it's like exciting that it's being acknowledged, but like not so exciting that it's happening more and more often,
Yeah.
and therefore getting
Yeah.
acknowledged. I've often joked
Yeah.
that if
And
ADHD was a term they used for children in the early 80s, early 90s, like I would have been on that list, you know? And when
yeah.
one of the reasons I wanted to interview you was because of your knowledge around that gut brain dynamic and sort of the gut and psychology piece. I know that in my own experience, like when I look back, I was a kid who had chronic ear infections, who had trouble hearing, like always had glue ear, and whose mom made a whole bunch of like really delicious homemade breads and cookies and sweets all the time. And, you know, looking back on it, I'm like, oh, if she had only known that that was what was causing it, or
the
that was
connection.
at least feeding the things that were making that a big problem, she probably would have changed what she was doing, but she really
Absolutely.
didn't know.
Yes. And yeah, it wasn't common knowledge back then. And also testing to prove that foods are causing an immune response. They're now available, whereas in the 90s they weren't available. So I think a lot of the pathology testing for these things like food intolerances and what's happening in the gut, it's all very new science, new technology. But once you sort of go into that area and start doing that testing for yourself or for your kids, you begin to realize some amazing things. Gut definitely driving a lot of illnesses that are manifesting. Yeah.
Mm-hmm. Now, you talked about neuroinflammation. Can you give me a little bit more, like what exactly is neuroinflammation? I'm like neuro is like the brain somehow, inflammation is like
Very new term. Yes, it's a very new term. It's sort of something that's really, I'd say probably towards the end of 2000s decade, it started to become a really popular idea. But what they discovered is that the brain has its own unique cells. There's three types. There's the microglial, which there's a lot of research done on microglial inflammation, oligodendrocytes. I can't remember the other one, sorry, but there's three types of neuroimmune cells. Discovered that these cells are very unique to the brain and that certain things will activate these cells to protect the brain and to clean the brain up. And what they've discovered is in certain diseases, these cells are actually overstimulated or overactive. And this is one of the mechanisms in PANS and PANDAS, and also conversely, something that's being studied in autism as well.
Okay. And what are some of the the signs or symptoms of neuroinflammation? Like you talked about quick onset of psychiatric symptoms, but like what else? You know, like.
And that would be in more severe cases where it's really clear your child is healthy and fine 1 minute, and then the immune system gets challenged in some way, whether it's a food intolerance, whether it's a strep infection or a cold or a cough. They're fine 1 minute, and then within a day or two or a week within getting sick, they're a different child. Some parents will describe it's like their child is gone, and the child may be ticking, so obsessing about worrying things that happen. There's also, in more of the worst cases, there may be some aggression, sort of rage and emotional lability. But sometimes it's also in a mild case as well, where it's just a bit of OCD behaviour, and you might stacking up their toys, or checking that no one's breaking into the house, and they might get up in the middle of the night and check 3 or 4 times, and that's quite mild, and it can be harder to pick that up. Yeah. So I think yes, the neuroinflammation. Generally, it can be mildly or severely, but generally it's I guess the most common experience for people, I guess as adults, is brain fog.
Okay. Yeah.
You can't remember why you walked into a room, or you're struggling to focus, or you read a page of a book, you turn the page and you can remember what the page. you can't recall what you read.
Mm-hmm.
So that kind of brain fog, not a dementia kind of picture, certainly forgetfulness, struggling to concentrate, feeling irritable, and then it's sort of a spectrum. There can be some OCD thinking, intrusive thinking, worrying thoughts.
Yeah, most people think that worried thoughts or some low level of anxiety is kind of just a normal way of living. Oh yes, I'm anxious.
Yeah.
That's part of human life. But what you're saying is that actually it's not like neurologically normal. It's something that happens as a response to the foods that we're eating and our environmental stressors. Is that right?
Neurological, biochemical reaction in the brain, inflammation in the brain that's affecting the way we think and affecting our cognitive function.
Wow.
Yeah. So, I mean, it wouldn't be in every single case, but certainly, I guess the way to really notice it is inflammation tends to come and go. So if a food is causing neuroinflammation, when you eat that food, you'll have high anxiety the next day.
Right.
Yeah. Mm-hmm.
Yeah, I've had experiences like that. Like after I had removed dairy from my diet for the most part, if I add it back in, I find that I have these thoughts of like driving off bridges and
Yes.
like these suicidal sort of thoughts. And I'm like, actually my life's pretty good, and that used to be really normal. But then
and
after taking dairy out, it's like, oh no, like this isn't normal. And I can see like the direct correlation. It's just like, wow. And so you're saying that's like literally like my brain is inflamed, sort of like there's like I'm blowing a balloon up inside of my head and it's like too big for my skull and it's sort of pressing and causing oh, we need to fix something.
Yes. So there's still some debate about the mechanism of action. Some people, I think earlier in years before, they thought it was an autoimmune. So if you think about autoimmune disease, we get autoimmune disease of our bones, we get arthritis, autoimmune disease of our pancreas, we get type 1 diabetes, we get autoimmune disease of our skin, we get autoimmune diseases of the brain as well. And it's been established that there are certain types of autoimmune encephalitis. However, with PANS and PANDAS and some of the sort of more general gentle, less extreme sorts of neuroinflammation, it is possible. The other theory is that it's actually inflammation in the gut and the intestinal lining is permeable, which is a lot of what GAPS talks about, the GAPS diet that you mentioned before, this leaky gut, that when you have inflammation, there's all kinds of things getting across that gut lining that shouldn't get across. And that we think it's those instances or bodies, or the toxins from bad bacteria, such as the strep bacteria, is actually translocating to the brain and triggering. So there's still some debate about the mechanism of action, but they're the two ideas that seem to be out there.
But regardless of which way it's scientifically working, the experience is that, there's some sort of stressor, whether it's dietary or environmental, and it's causing, this whole
exactly.
Exactly.
Yes. Yep. Exactly. It is a bit scary, but at the same time, it's an incredible relief particularly with a lot of mums who've had children with multi-diagnosed ADHD, pathological demand avoidance. These things have been on every single medication and nothing works, and then to come and find out about neuroinflammation and see some progress, it's just great joy to be able to share that journey with a mum and a father.
Now, do you work with probiotics or with vitamin therapy or with changing diets? Like, what's your biggest?
Depends on the case. I guess it depends on what you're dealing with. I mean, because not all OCD is PANS and PANDAS, and autism and PANS and PANDAS is very different type of neuroinflammation as well. So it really actually does depend on the individual and what's going on. And it's really more of a case of being a detective, finding out, listening carefully to the mum about the symptoms and trying to measure those symptoms. And then doing some of those pathology tests like the organic acids test, DNA methylation test, that you can work out what the drivers are, or a food intolerance test. So from that information and listening carefully to the mum or the dad, you work out what the drivers are. And in some cases, it can be an allergic response. It can be an exposure to mold. It can be a straight strep thing, or it could be an overgrowth of something in the gut that's reducing diversity of the biome. And that seems to be associated with disease, loss of diversity in the biome as well. So, yeah, there's lots of things to consider. Yeah.
Wow.
So I guess some of the treatment plans probably involve, we look a lot at methylation and methylated Bs, methylated B9, L-methylfolate, methyl B12. Sometimes that's what's needed. Other times it's about using gut herbal antimicrobials to gently and safely remove something that's been identified in a test, and use probiotics to grow the garden and make sure there's a lot of diversity, because all the evidence shows that one thing we know for sure is that the more diverse the gut is in its biome, this tends to be associated with good health. Yeah. Wow. So yeah, it's a mixture of things, and then herbs as well to manage symptoms.
Right. Yeah, because there's so many amazing plant medicines out there to help with the symptom.
I'm just in awe of plant medicine. Yeah, I'm in awe of it. There is so much magic. We still know very little about how plant medicines actually work on the body, but yeah, they're great.
Great. Now, you had mentioned to me before we got on the phone this piece of like where clients feel validated when a test or a prescription results in confirming something that they felt they already knew, or they thought they knew where the problem was, and then there's this moment where like, oh, like, you know, there's a test or something that validates that. Can you speak to a little bit about that? Because for me, it's like a mother's intuition is so beautiful. It's such a powerful thing. And yet often when it comes to medicine, when it comes to our children, when it comes to like choosing what we do for medicine, there's a lot of programming around Western medicine and allopathic medicine, and take this pill and do this thing, and antibiotics are the solution to everything, or maybe we'll just cut it out, or whatever those solutions that they're offering are. Can you just speak a little bit around what you've seen in terms of intuition and
and my own experience too. So I have 2 children on the spectrum as well, so I've experienced it too. So there's definitely this medical kind of what do you call it? I guess some people call it the merry-go-round, but it's definitely a certain journey and an experience that you kind of fall into a system, and it's the same, like the solutions and the treatments that are offered are the same thing for everyone. There's not really a recognition of the unique challenges of a person's situation. But yeah, I guess I would say is that in my own journey and other mums who have ASD kids that I'm friends with, and also with clients, is there's definitely a case of it's a very disempowering experience, because you're meant to trust the expert, and when you sort of question things or ask questions, it's very discouraged. So as though you have no option and this is the thing you must do. And so sometimes I can think of a good example, like when my daughter had asthma. She had very severe asthma when she was 3 years old, and she had to go to hospital. She was struggling to breathe. And I can remember being in the emergency room, and they just wanted to give her immune suppressing drugs to stop the asthma event. But I knew deep down that she had pneumonia. I knew that pneumonia was triggering the asthma. And I did not want to give her an immune suppressant medication such as prednisolone if she wasn't going to be treated if the pneumonia wasn't going to be identified and treated first, because it would have made her a lot sicker. And I can remember saying to the doctors, I'm not saying yes to the prednisolone until you do a chest x-ray and confirm she doesn't have a chest infection. And I was made to feel like I was gaslighted, basically. And it really opened my eyes that when you're sick or you're being dealt with a diagnosis, particularly a chronic one such as autism or epilepsy, that it's a very disempowering experience. There's not informed consent that goes on. So you're told to take these medications, but you're not told that these medications will cause atrophy of your adrenals, that it will give you early onset fatty liver or early onset diabetes. Yeah, that doesn't seem to happen. And so these parents are kind of not really given options. They don't feel like and you have to really stand your ground to say no to medications as well.
Yeah.
So so that's one of the reasons that really drives me to do what I do, is to help women, and it's usually the mums I'm dealing with, but occasionally it's the dads, is to help them make more informed choices, and to help them understand the newer ideas that are coming out in science as well, such as neuroinflammation. So I don't know what your country's like, but I know in our country, the idea of neuroinflammation is still yet to sink into the psyche of conventional medicine.
Oh, yeah, sure.
It's still very much brain chemistry. You know, ADHD is very much, it's brain chemistry. It's all about dopamine deficit. Whereas sort of the new science is saying, well, actually it can be to do with food intolerances, sensitivity to preservatives, sensitivity to glutamates, and can actually also be a sign of PANS and PANDAS neuroinflammation as well.
Right.
So, so I guess I see my job a lot as the mums who know deep down in their guts that my son's behaviour gets worse when he gets a cold. I know there's something there, and I will go with them on that journey to help them investigate and work it out. That yes, it is a neuroinflammation condition, and if we manage the inflammation and we fix the gut, we can get them to a better space, better place.
Yeah, I can feel you in that too. It's just like,
Yeah, I know my warrior energy comes out a little bit.
Yeah. Oh, so beautiful. And it's so important because, like, when I look back over my own journey, like all of the signs, and like the asthma and the allergies and the ear infections, like all of those were there when I was under 5, under 7, under 10, right? And that resulted in teenage depression, and that resulted in like major postpartum depression after my son, and that resulted in like some crazy ass stuff that went down in my mid-20s, and all the way through, like, and somebody who had your knowledge base who looked at me would have been like, like, hold up, we can fix this, we can fix this. We can fix this really fast.
Yeah.
You don't have to wait till you hit like a major crisis in your mid-20s to solve it. You can start checking with whoever, with you or with whoever's a naturopath nearby, somebody, reading the GAPS book is a huge piece in like first education around this. You have some like websites that you go to for information or books or resources that you are like, this is the cutting edge information around neuroinflammation or psychology stuff. What would be your recommendations around that for people?
Yeah, gosh, there's I guess it depends on what you're dealing with. I would say if you think possibly that PANS is an issue, or even your own, intrusive thinking, negative thinking, or changing of moods is more to do with I would say neuroimmune.org is a very good resource. I think it's actually a Canadian group, physicians and medical professionals who really good information about exactly what PANS and PANDAS is. They do support, though, IVIG treatment, which is very invasive treatment. It's very expensive as well. It's quite, I think it's something like $25,000 American treatment. It doesn't always work. So I guess I want people to know that there is another way. You can do it. Herb nutrition, you really can. And I think some people are surprised at how little it costs actually to resolve PANS and PANDAS. That to expect cost tens of thousands of dollars. So yeah. Did I answer the question? I think I did.
Yeah, you gave a resource at the website. I was like, where can people, like,
Yes. Okay. And the other one, yeah, I guess the other one for women too is Kelly Brogan.
Okay.
I love her work. She is very much about that, mental health is a neurobiological thing, not a chemistry thing. And she's got some great resources about if you're dealing with depression or anxiety, the first thing you need to check is your B12, check your thyroid, so on. She's a few other things as well. I find her information very good. Yeah.
Awesome. Yeah, I mean, the thyroid, super important. B vitamin, super important, especially I was reading about vegan diets and lack of B vitamins and how that's super important, especially because I know a lot of people who have gut psychology stuff. They go, okay, well, I'm like, no more dairy, no more eggs, no more, they do these things, and then they're not necessarily adding in the B vitamins or the omegas or the lecithin or whatever it might be, that then helps support, having really all the things that your brain needs in order to make the neurochemicals that help it heal and help it function really well.
That's right. And that gets us in the DNA aspect of mental health too, is that some people don't metabolize B12 very well, don't be known very well. And so when you sort of start emitting food groups from those with those vitamins, is pretty much derived from animal sources, and also zinc as well is another important one. That if you have those DNA fragilities or weaknesses, that you can actually compound or exacerbate anxiety or depression. So I guess if you are trying to go vegan or vegetarian or paleo or any of these options, there's so many options out there, or even keto as well. Get something done. Firstly, a food intolerance done, because if you decide to go vegan but you've got a food immune response to every single grain, it's not going to be a good outcome. And if you choose to go paleo, and eating too much protein can actually be quite damaging to the gut bonds. You can really deprive the gut of a very important compound called butyrate, and butyrate makes GABA, serotonin. So so I wouldn't say there's one magic diet for everyone. I would recommend get testing done, food intolerance, get your DNA methylation test done, and get a GI map done. So you're going to try something and it fails.
Yeah. So you've got baselines to work from when you start modifying things, because it's one thing to, to go on sort of subjective experience, but it's quite another thing to have like numbers and be like, okay, like my body's now methylating better because I've added in these vitamins, or rather than, I just feel better, right? I did years and years of tracking food and sleep and water and poop and bloating and just like all of these things. I was like, actually, like what the tracking taught me was actually my subjective experience of my life is more impactful of how I feel in any given day than any of the other things I was doing. It was like, I could add food, but like my perception, I'm having a bad day, could like totally ruin my day. But then also like I said about taking dairy out, like that was huge for me.
Yeah. Oh, wonderful. Yeah. Yeah, absolutely. So when you find out what triggers or your cause, it can be life-changing. It's like suddenly everything's working better.
Yeah. Yeah. And, you know, it's hard. Like, I would consider that had that experience for a large chunk of my life. So I didn't know that walking around with something that felt like it was in front of my face that kind of kept me from feeling really connected to the rest of the world wasn't part of a normal human experience. That was just how I interacted with people all the time, kind of feeling, you know, a little disconnected and a little like there was something between us. And it wasn't until I started doing, you know, this digging and this research that you help people do with their children when they're really young. I'm so grateful for. That it was like, oh, you know, life can be different. And the sense of like getting your child back, like getting that joyful, happy, beautiful child that you really, you know, that you gave birth to and that you really love, and finding that and being like, oh, like I trusted my intuition. I went with you know, the medicine that made sense to my heart, made sense to my mind and my intuition. I asked for help, you know. My experiences with naturopaths have been like really supportive. I was like, wow, like you just asked me more questions than every doctor that I've ever seen all combined into one appointment. Like, you just asked me more questions than every doctor I've ever seen in one appointment. I feel like I've actually been, and you can't underestimate the power of being seen and heard by somebody who cares, like, which is really, unfortunately, really rare in the allopathic Western medicine world.
Yes. And that's what we're taught, is that we're taught that the client sitting in front of us actually has all the answers, has all the information, and we've just got to bring it out and words they can understand, or it gives it kind of like more of an intellectual, I guess, description to it. For example, feeling like this and brain fog, you know, it's like, oh yeah, it's brain fog. Yeah, this
is brain fog, not how I live my life.
Lots of people feel it.
I was talking with another mom today who's like, oh, I just have brain fog. And she was talking about how, you know, 5-10 years ago, she was running a business. She was working 14 hours a day, just like pounding it, like just rocking. I was like, well, first of all, that's a little too much for any woman's nervous system, I think. But also, like, she burned out at the end of that, and now has thyroid issues, now has like this brain fog experience. She's like, by mid-afternoon, I'm toast. And I'm like, that's probably like methylation and a lack of nutrients and like overactive adrenals. I'm not a doctor, but that would be, I would start there, you know?
But intuitively, you can see it. Yeah, you can, as a friend, you can intuitively see it in her, but it's about, just giving it the right labels and yes.
Yeah. You said the right labels. That's a great little segue. Do you find that the labels that people put, like, you know, like my child's been diagnosed with autism, like we recognize autism as a spectrum. It comes from, you know, mildly severe to like crazy, really challenging severe. Do you find that those labels are helpful for people or like not so helpful for people in your experience?
I think labels, words are used to communicate ideas so that people can understand what each person's talking about.
Yeah.
So again, you say autism or epilepsy, then immediately it helps the other person understand what you're talking about. Labels, do you mean in terms of like discrimination, and then people then have expectations about that child or that family? I think I guess it's been a mixed result. When I talk to my other sort of friends who've got kids with disabilities, it really opens up the space for a bit more compassion and a bit more understanding, and people wanting to know and wanting to support, learn situations to succeed. But then I can think of time where a label has meant that not much is expected of the child, so they just give up on them. They kind of get babysat rather than educated. So I have seen that happen. And then when there's the really mild cases, of course, this is probably a much more common situation, is that a lot of children are mildly autistic or mildly ADHD. And so they can be very good at masking it. So behaving perfectly at school, and then coming home and becoming very dysregulated. And so those children are very good at mimicking and copying and trying to blend in, and they've got a sense of social survival. Yeah. And but they come home and they just dish it out to their mother or their father. They'll lie on the floor and scream for 40 minutes because they're just so dysregulated. They've been holding it together all day and they just need to let it go. And particularly I find in the early years of the diagnosis of autism, as a mum, you don't really understand. You're trying to do the super nanny, do the naughty corner and try to do these parenting strategies, and they don't work. They seem to make things worse. And so you're stressed out and they're stressed out. So there's this, especially in the early years, when you're still trying to work out what autism is and what the autistic brain needs to function really well. And then you try and talk to it about other parents who don't see that. There's a bit of gaslighting that goes on. You're making a big deal about something, you're looking for attention, you're trying to get special extra attention for your child in class. There can be that going on as well. So it's, labels, I'm not sure. It's a mixed bag.
And what about, have you seen people who I was kind of curious around, getting labeled with a specific mental illness and then getting to a point of let's call it recovery or change in symptomology where those things aren't necessarily active anymore. And then
having dairy.
Back to doctors and getting relabeled or re-diagnosed. I've seen with some of the people I've worked with, there's my kid's autistic, therefore it'll be there forever, or like there becomes this like identification with the set of symptomologies or with the set of the label that's been given. Can you speak to that a little bit?
Yeah. Gosh, yeah, I do see that, but I don't really understand it. I think a lot of people, I'm probably thinking of people here who over-identify with their own illnesses. In that, it's more of an excuse to not reach your potential, I guess. But it's not that people that's a question. I would say it's more about people are so afraid to put themselves out there and be vulnerable that they can hide behind their labels. It's just a place to be. I guess, but then sometimes you're using the labels to try and get people to understand how hard things are. Because a lot of these things like autism and ADHD are actually invisible disabilities. So, I don't know. I think it's very much a mixed and very personal experience. Yeah.
Thank you. I just wanted to get your 2 cents on it. I think there's a danger in over-identifying with any particular. I come from like a Buddhist philosophy in that, but like the over-identifying with any particular thing, right? It's just like, okay, but that doesn't mean that. Go ahead.
I was going to say, I know exactly what you're talking about. Over-identification with the role and the persona. And I think most people do it. People do it with their work. People do it with, their education. I suppose you could do it too with your with your illness as well. Yeah.
Yeah, which can sometimes hamper sort of a recovery journey if it's like
it's much
I am this, right? I am being such a powerful statement. I am autistic. It's like, I'm experiencing autistic. I like to say I'm experiencing autistic symptoms right now.
Yeah.
That helps me because then because I do have a tendency to like
identify and try and control yourself. You are more than your disability. Absolutely. Yeah. Yep.
Yeah. I had a quick question. I wanted to jump in here. I had a woman in one of my support groups for moms, our Bulletproof Moms group, and she has 2 kids that have been diagnosed. Maybe I should just connect her with you directly, but like kids that have been diagnosed and are on psychiatric medications and are having challenges with verbalize some of those thoughts that you'd mentioned, like the recurring negative or like dangerous or self-harming thoughts.
Yeah.
If there was like one piece of advice that you could give to a mom like that, whose kids are sort of like really struggling, just be like, try this, is there something that's like safe for them to try that they could try?
Yes, there is definitely a test. So because it's inflammation, to work out whether it's inflammation or whether it's just, a dopamine issue, is to give them an anti-inflammatory. Okay. So if you've got a child that's highly anxious, got a lot of OCD thinking, or you suspect they're hiding OCD thinking, or they've got a lot of repetitive behaviour, and particularly if it comes and goes, try them an anti-inflammatory for 4 to 5 days. So some parents will try Nurofen, or I'm not sure what kind of anti-inflammatories you've got in your country, but just the typical, I think it's called Motrin in your country, Actimorphin, ibuprofen. So everyone's got some in their cabinet, and if you give this at the normal dose for 4 or 5 days, you'll see a reduction of the either the OCD, you'll see a reduction of the anxiety, you'll see some improvement symptoms. And if you give us, and you can use other anti-inflammatories like curcumin, liposomal curcumin is a good test. And there's other anti-inflammatories as well, like boswellia, which is frankincense, or white willow bark. It's also called Salix alba. So there's some herbal anti-inflammatories too, or the ones that you've got in your medicine cabinet or from the pharmacy. Give them for 4 or 5 days, and if you see a reduction in any kind of symptoms, then you know that it's neuroinflammation.
Got it. Because you're literally adding something in that takes that inflammation down, and then it's like, okay, symptoms are relaxing. Okay, well then obviously it was inflammation, and then you have at least that information. You can go check in with someone who's a naturopath yourself and check in on that.
Yes, absolutely. They seem to be more themselves. But saying that, it's not a management. I don't recommend taking it for more than 4 or 5 days because ibuprofen things. It really is just a test. It's not a way to manage symptoms. We use lots of different things to manage symptoms.
And realistically, we don't, like when somebody comes to work with somebody like you, they're not looking to manage. Partially it's about managing symptoms, but it's about like addressing the underlying issue that's causing the neural inflammation, whether that's diet or like a reduced microflora, or like probiotic in the body, or allergy foods, or high stress or high environmental toxins or high food toxins, whatever those things might be, right? So it's about like managing the symptoms is sort of like from the top down, and we're talking about like taking the roots out from underneath the problem, being like, okay, well, we're not going to feed the problem at all. We're gonna take all the things that are feeding the sort of the problem and take those away slowly over time, so as not to crash at anybody's nervous system. And then the new baseline is sort of here, and then there's less symptom managing to do, and then you can use again like natural remedies to manage those symptoms as opposed to pharmaceutical remedies.
Yeah, that's what we do.
How relieving does that feel? Even just like talking to you, I'm like, oh my gosh, like somebody who understands the path that I sort of like wheedled and wove and bubbled myself through for 10 years. It's like, oh gosh, I could just ask somebody for help who knew all the things. Oh man, how helpful would that be?
Yes, and for previous generations, we've had to really find a hard way
Yeah.
So that's why I'm so hopeful, because this current young generation, we've got these really good, much better technology in mapping it up. We know about DNA methylation. We didn't know about it 20 years ago.
Yeah.
All of these things we now know, and because of that, kids right now have way better chances than you and I had. So that hopefully they'll get through school and won't be traumatized by school and all of yeah. I know. I'm looking very forward to the future. I think I feel very positive about it.
Yeah, that's awesome. I'm so glad that we got a chance to talk and we get to share like this.
Yeah.
If people want to reach out to you, if they're based in Australia
Yeah.
area and they want to work with you in person, where exactly? I think you're in Australia, right?
Yep. I am in Australia, in Melbourne. I do Zoom consults, and I do have clients in other countries, so it does work. The time zones can be a little difficult sometimes. And the other constraint is that the testing you would actually have to get done in your country, because you can't transport saliva and stool samples between countries. So you would have to find someone to do those tests, and then I would help you interpret those tests and then help you recommend protocol for improving symptoms and then working on how to get the guts in a better shape. So yeah, for sure. So if you just, you can find me on my Facebook business page. If you just search Robyn Cogger, Cogger, you'll be able to find my Facebook page there, and you can send me a message. Yeah.
Awesome.
So,
Great. And I'll make sure that's in the show notes down below the interview too when we get that through.
Thank you.
Beautiful. Is there anything else that you wanted to share? You know, if there was anything else you wanted to speak to that mom who's struggling with her kids and their diagnoses and the knowing
and doubting them. Yes, I'd say to the mum that's doubt. You know, they know in their guts that there's something to the story, but they're not getting that support from the medical or even their own family. Is to back yourself, really back yourself, and you need to find the people you. You need to go out and search for those people who are literate in neuroinflammation, literate in gut health. Will give you an alternative perspective on what's going on, because the science right now is just, we're in a renaissance period when it comes to health science, but not really conventional medicine very quickly. And so I think and have read science articles too, because you'll find the answers in there sometimes as well. But yeah, just to back yourself, you know, and trust your intuition and stand your ground.
That's right. Just because they're doctors doesn't mean that they know what's right for your kid. They're actually there to provide more information, run tests, give options, not a be-all, end-all of what the right answer is from information they learned 20 years ago in school that isn't fact.
And they're locked into a system too. They're locked into a system too where they're not given much time to be with you, and they have to follow very strict rules. So, you know. Yeah.
Beautiful. Well, I hope to have you back on again soon. And I'm just going to end the recording, and then so we just say bye to everybody. Thank you so much for being here, guys.
Thank you.
Thanks for watching.
Okay.
Okay.